Okay, but now in the prone position, okay, I've got passive compression of the breast against the floor. All right, so a lot of people, and I think, you know, a factor of our culture, and rightly so, you know, it's prejudice, but a lot of people are very sensitive about breast massage. I have to say I'm very proud to have been part of the group of people, of therapists and activists, writing to state legislatures and massage boards for the last 20 years to get the states to start to actually recognize the value of massage of the breast and actually include it in the scope of practice for most massage therapists. Okay, because trust me, 15, 20 years ago, it was not only not part of the massage therapy scope of practice, it was a crime for you to do it. Okay, the only reason these legislatures, like the state of Florida, the only reason they added that to the massage therapy scope of practice is because people like me, doctors, therapists, nurses, and so on, wrote letters to the state legislature, to the governor, and to the massage boards, and we included references, scientific references, for all of the health benefits from all over the world, and especially Canada and Australia, about the benefits of breast massage and prevention of cancer and prevention of chronic inflammatory disease, among other things. And as a result of that, it was added a couple of years ago. It was added to the scope of practice for the state of Florida. And that's now starting to happen all over the country, okay? But still, a lot of people are behind the curve a little bit. There's a lot of prejudice, a lot of kind of religious kind of ideas, and you know, and I've had clients who I could never massage their breasts. A, because I'm a guy, you know, by definition, guys can't do a therapeutic massage on a woman's breast. It's always groping. Okay, now I don't agree with that. I completely disagree with that, but that is a prejudice. It's a societal, social prejudice. Okay, and so if I have a female client who's sensitive about it, but she really needs that stimulation, I flip her over into the Prone Savasana position and I rock her like crazy. And I do a lot of compression on the upper back, I do lots of rocking, and that is compressing the breast, right? So I'm getting that stimulatory pressure on the chest and on the axilla and on the pits, you know, what's the axilla, like the pits, you know. I'm getting that stimulation, but I'm getting it indirectly. It's non-threatening. And this is very valuable. I'm also getting compression and stimulation of the abdomen, you know, with body weight compression and the floor weight resistance. And when I move the body, it's actually compressing the body, okay? I'm getting it in the groin, okay? I'm getting it in the groin. And also, the number one reason for lost work, according to OSHA, the number one reason in the American workforce for lost days at work, according to OSHA, is low back pain. Okay? That's number one. Number one reason why people miss days from work, according to OSHA in the U.S. Government, is from low back pain. Okay? I want to say if I take 10 people with chronic low back pain and I do a postural analysis of them, 9 out of 10 will have a severe anterior rotation on their pelvis, and they will have a posterior and superior rotation on the low back, and that's why they have compression on their low back. If I do a postural analysis, maybe I'll show you guys this later, how to do that. But when you're in the supine position, in this yoga posture, okay, it is actually lengthening the quadricep here. It's lengthening the quadricep. At the same time, the floor is providing a little bit of resistance against the front of the pelvis. All right? So in this posture, it is the easiest, simplest, least stressful way to stretch the quadriceps, simply laying in Savasana on a firm surface. Does this work on a bed or a really uber soft mat? No. Because the mat lets your body contour. That's why it's more comfortable. See, if you're in Prone Savasana, it should be a little bit uncomfortable if you're not balanced. You should feel pressure. You should feel a little strain, maybe in your low back. Now, a lot of people say, that's why I don't want to be on my stomach. It's because I feel some compression in my low back. Well, the reason you feel that compression is because it's lengthening the quadricep. It's pulling down on your pelvis. But we want that pull because we've got to lengthen this to release the pressure so the pelvis will rock back and open up the low back. Okay? This is the gentle way to do it. Now let's look at the neck. Okay? She's turned her head gently to the side. According to the American College of Orthopedic Surgeons, the average American by age 30, okay, not by age 60, by age 30 has lost 20 to 30% of the range of motion on their neck due to atrophy. I'm going to think about it. The average American by the age of 30, how many people here are close to 30? One way or the other, or above. Okay, well, it's more than half the class. The average American. And what if you have that in your 20? Okay, that's 20 to 30% by age 30, and it only gets worse as you get older. And it's from atrophy. Why would you have atrophy in your neck at age 30? Anybody want to guess real quick?
Static computers and TV.
From not using it. Atrophy is that you don't use, you lose, right? That's the definition of atrophy is you don't use it, you lose it. Okay? So the only reason why a 30-year-old would lose 30% of their range of motion due to atrophy is because they are no longer turning their head. If somebody behind you calls your name, you take 3 steps to turn around and look at it. Okay? That must mean that when you're driving on the highway, you're not even checking your side mirrors. You're not even looking around behind you to see if somebody's pulling up. That means you're just like this when you're driving. It means you spend a lot of time in front of the TV, a lot of time in front of the computer, a lot of time doing apparently nothing that requires you to turn your head from side to side. All right. Now I'm going to give you a little test which you can do, because remember I said yesterday, don't take my word for anything. I talk such a bunch of hooey. Don't take my word for anything. Do your own due diligence. Do your own process of verification and validation. Okay. But here's what I'm going to say. This posture is so incredible because Savasana alone will solve the problem of atrophy in the cervical tissue. This alone. So if you have no therapy, none whatsoever, if all you do is get on a mat like this, or on nice carpet, but it's got to be firm, you can turn your head from side to side as you feel like you need to, but you got to let your body fall flat, no support, okay? If it's too uncomfortable, you turn to the other side, all right? And when you do this, when you first lay down, I want you guys to turn your head to both sides. I want you to see that there's a radical difference in how comfortable you are from one side to the other. That is the sign of atrophy. That's what that means, okay? And atrophy is why you get whiplash when you're in a car wreck. It has nothing to do with the lady pulled out and hit me at 5 miles an hour in the parking lot when I wasn't looking. No, you had 30% atrophy in your neck muscles to start with. And then you have that 5 mile an hour collision, and guess what? Now you have whiplash. But if you had fully functioning cervical tissue, which was elastic and able to do its job, which is to act as a shock absorber and impact, you wouldn't have had the whiplash, or you wouldn't have had the degree of the whiplash. Okay? If you're already broken, it doesn't take much to hurt you. Right? Now, so what you do is you lay on your stomach, and what I want you to do is stay flat on your stomach for 15 minutes. That's it, 15 minutes. But you have to do it every day. 15 minutes on your stomach every day. Lay your head flat. You can change sides when you feel like, it's a little strainy and I want to turn to the other side.
Can you sleep that way?
Yes. If you're on a firm bed. If the bed's really soft, no, because it creates another issue. 15 minutes a day, every day, and in 28 days, okay, you will increase the range of motion in your neck by up to 20% with no other therapy. So no chiropractic, no massage therapy, no deep tissue, no Thai yoga. Just lay in the yoga posture of Savasana 15 minutes a day. Turn your head from side to side. I know ROFers. I know deep tissue specialists, neuromuscular therapists, orthopedic surgeons, chiropractors who have worked on people for years and not been able to get them to recover a full 20% of the range of motion. Isn't that funny? This will do it in 28 days with no therapy because the posture is therapeutic.